Robot-assisted surgery is growing globally, and at the forefront of this technology is our own Urology Hospital in Pretoria. Now, 6 years ago, it became the first facility in South Africa to acquire the Vinci robotic system. Our Matilda Mutuatlacha has more.
Will robot-assisted surgery be the next healthcare revolution in South Africa? Well, the Urology Hospital in Pretoria is already forging ahead.
We've been the first hospital in Africa to acquire a robot, and it's one of the main ways that we treat prostatic cancer now in this hospital.
Wondering what the innovation entails?
This is a development that brings minimally invasive surgery to more patients because more surgeons will be doing these procedures with this machine.
More doctors would then also, as time go by, acquire the skills to be able to operate minimally invasively on a patient without having to make huge cuts with the associated morbidity with open surgery. We try and circumvent that, and that's a big advantage to the patients.
It's clear that technologies such as this play an important role in improving the recovery time for patients, and they are taking the healthcare industry into the future. Matilda Mutuatlacha, Johannesburg.
Fantastic stuff. Now, for more on this and the future of medicine and technology in healthcare, I'm joined by Dr. KK Ijane. He's the first black urologist to become a robotic surgeon, not just in South Africa, but on the African continent. Doctor, thank you for coming through, and also, well done. I mean, this is an amazing feat. What did you have to go through to become a robotic surgeon?
Thank you for having me. It's a long journey. Mm-hmm. Where first you must qualify as a surgeon. You must be a urologist who's doing certain surgeries. And then those surgeries, you then have to be able to move from doing them from open to what we call endoscopy. And then luckily for us now, we've got what we call a simulator in the country.
Yep.
So you don't have to go outside of the country to start the training. You start practicing the simulator here. You spend hours and hours with lots of modules and exercises, which you really have to score very good scores on. Mm. And the machine also scores you and marks you. And then after that, you take online tests, online modules, you watch videos, and then only then you can be sent outside in one of the European countries, where you will then spend some time in the wet lab with more further training. And then you come back, and only then you start being proctored, meaning that you perform surgery under supervision to a point.
Yep.
And then at some point, the teachers or whoever is overseeing you feel like, okay, you're good enough.
You're ready to go.
Absolutely.
So this
that's
is
what it takes.
What we're looking at now, this is what we call the Vinci robotic system, is it?
Of course, this is the Vinci.
And this is what you use.
This is what we use. This is what we have at the Urology Hospital. So it's got three components. What you see is what we call the patient's cart, which is the machine connected to the patient, and that itself is the robot. And a little hole where we call it a console, where the surgeons sit there, look there, and using what we call manipulators, and then you can then move all those robotics arms to perform surgery. Mm-hmm. And there is a monitor, just like the screens you guys have, for visions and for everyone to can see what you're doing.
What is the advantage of this, the traditional surgery? Of course, you've got your nurses and so forth around you, passing you things, is what we see in the movies. Mm-hmm. What's the difference? What's the advantage here?
I think with moving technologies with life, we want to do bigger surgeries with less damage to the body. So in an ideal world, we want to be able to perform, no matter how big the surgery is, with as minimum damage to your body as it can be. And this is where the advantage comes. So now, a robotic is just an extension of what traditional was called a laparoscopic surgery, where we put little sticks inside your body, we control them with our hands to do the surgery.
Yeah.
With the robot, now, the arms of the robot has got an advantage that it has got a hinge and a movement like a wrist.
Yeah.
So the stick are long, but then you've got almost a 360 rotational move on those little sticks. You can access deep holes, very, very narrow spaces, and because of zooming, And because of 3D, you can do very safe, delicate, precise surgery with this.
Okay, and you're doing this within the same environment, as in you've got to be close to the patient, or can it be
it's
far away?
It's got a lot of potential. You literally can be operating from another room and not sitting in theaters. And in the future, with better connectivity, better fast message relaying, you can be operating from another city. So you might be sitting in Cape Town and supervising an operation or performing a surgery in Pretoria. What these machines are designed to do is to interconnect also, where there can be a surgeon, a co-surgeon, and even somebody else assisting you from another pod.
Yeah.
And then that can help a lot in assisting the surgery. So in the future, this will be able to assist in fewer people maybe sitting somewhere in some remote area and doing an operation somewhere else. You still need qualified people by the patient to oversee, connect the machine to the patient, make sure that the patient is safe, and for that and that.
Are we heading in the right direction in terms of South Africa and also Africa when it comes to technology and the potential impact it has on healthcare provision?
We are. The only problem with South Africa is that we're one country with many worlds. So you could be in South Africa living in the very third world, you could be in South Africa living in the very first world. The bridge between those two is a big challenge that need to be addressed. However, we can't allow ourselves to fall and lag behind from technologies. And this is the future, where we can do surgery without having to give you blood transfusions. We can do surgeries with you being able to return to work within a few weeks. Some guys even go to work within days. I mean, this surgery was done on a plastic surgeon who was back working in a week. Under normal circumstances, you would have been off for about 6 weeks, or even up to 3 months. And you don't need even intensive care and high care, which are all cost drivers. Patients can be observed in the ward, just a general normal ward. Of course, the initial price pay up for using a robot versus an open surgery, it's a little bit stiff. But the added benefit is that all the other stuff that we should have gone through are now eliminated. So then that's the overall benefit. As
Job losses, no more nurses needed?
No. You'll always need a nurse. You'll always need a technician. You'll need an operator. So all what is needed is retraining. I think we're just too scared to move with technology with this job loss business. We're just going to have people retrained. And that's all.
Upskilled.
If you look at it, you still need people in the theater assisting with the machine, connecting the machine, monitoring certain stuff, but not necessarily so many hands involved in the operation itself, minimizing infection, access, touch, contacts, and etc. So it's a big thing to do, and we're quite privileged to be there, and I'm quite happy to be one of the guys doing this.
Fantastic stuff. I mean, it's amazing. I'm looking at that machine, and you sound very passionate about this. It's called the Vinci, a robotic system, and thank you so much, Dr. KK Ijane, who's become the first robotic surgeon, not just in South Africa, but on the continent as well, joining us in studio. Amazing stuff.